Nurses are the backbone of healthcare. Their knowledge, skills, and dedication make an immeasurable difference every day. A pleasant day to everyone. I'm Noela Anjao, and together with me are my groupmates, Marianne Adeva, Ayla Balalitan, Sarah Angelica Benavides, and Mary Krizia Doronilla. And we are the Group 1A from BN3A. And today, we're going to present our research study entitled Level of Knowledge and Attitude Toward the Use of E-Cigarettes Among Nursing Students.
For the purpose or objective of the study. This study aimed to determine the level of knowledge and attitude of nursing students toward the use of e-cigarettes according to sex, year level, smoking status, and family monthly income. This study also aimed to determine if there is a significant difference and relationship in the level of knowledge and attitude toward the use of e-cigarettes among nursing students when grouped according to the profile variable.
Now let's move on to methodology. The study employed a quantitative descriptive research design to assess nursing students' knowledge and attitude toward e-cigarettes, considering social demographic factors. Using a survey method, data was collected through a researcher-made questionnaire distributed face-to-face. Participants were level 3 and 4 nursing students from a local university in Bacolod City, Philippines. Stratified random sampling ensured representation across classes. A total of 214 level 3 and 119 level 4 students were selected. The questionnaire consisted of three sections: social demographic profile, level of knowledge, and level of attitude. Knowledge was measured using true, false, I don't know questions, while attitudes were assessed using a Likert scale. Validity and reliability of the questionnaire were confirmed through expert validation and Cronbach alpha testing, respectively. Data gathering followed ethical guidelines with informed consent obtained from participants. Confidentiality was ensured through data encryption and secure storage. Ethical principles of autonomy, beneficence, and confidentiality were strictly observed throughout the study. Descriptive and inferential statistical analysis were conducted to interpret the data, including frequency distribution, mean scores, independent sample t-test, ANOVA, man-witness u-test, and Pearson correlation coefficient. For the participants were level 3 and level 4 nursing students from a local university in Bacolod City, Philippines. Stratified random sampling ensured representation across classes. A total of 214 level 3 and level 4 students were selected, 95 from level 3 and 119 from level 4. The specific participants were decided by alphabetically assigning a specific number to the students, and then a random number generator was used. This guaranteed that all the students had an equal opportunity to be chosen as participants.
Instruments. The research-made survey questionnaire was validated by three professionals in the field of nursing with an average score of 4.90 interpreted as excellent. Part 1 determines the socio-demographic profile of the participants. Part 2 contains the knowledge questionnaires towards e-cigarettes. Participants must select one of the three options for each question, which is true, false, or don't know. The verbal interpretation for the level of knowledge is good if the mean score range is greater or equal to 3 and poor if less than 3. Part 3 contains the aptitude questionnaires towards e-cigarettes. The necessary responses to the questions in this part use the Likert scale. The verbal interpretation for the level of aptitude is good if the mean score range is less than or equal to 15 and poor if greater than 15. For the reliability test, the Cronbach's alpha score of the knowledge domain is 0.78 and the attitude is 0.76.
Now for the results and discussion. First, the socio-demographic profile of the participants. Majority of the participants are female. This implies that the proportion of male nursing students is significantly low compared to females, indicating that they were underrepresented and that nursing is a female-dominated field. For the year level, majority of the participants are level 4 nursing students. This suggests that there's a higher enrollment rate among 4th year compared to 3rd year students in the College of Nursing. For the smoking status, majority of the participants have never smoked before. Majority also neither use vape nor cigarette. This implies a positive trend towards healthy lifestyle choices among nursing students, which aligns with the emphasis on health promotion and disease prevention in nursing education. Majority also answered that they had been taught to give smoking cessation teachings to patients. Majority also agreed that as future nurse and health advocate, they have a role in helping smokers quit smoking. This implies that student nurses are prepared enough to do counseling regarding smoking cessation. They believe that as future health advocates, they can help smokers in smoking cessation. For the family monthly income, majority have family incomes ranging from 76,669 pesos to 131,484 pesos per month. Overall, there is a substantial representation of middle to upper middle income families within the sample. For the level of knowledge toward e-cigarette, the result shows that the participants have a good level of knowledge with a mean score of 3.77 and standard deviation of 1.35. This could imply that students enrolled in health-related courses had a good understanding of e-cigarettes, indicating their awareness of these products. For the level of attitude toward e-cigarettes, the result shows that the participants also have a good level of attitude with a mean score of 3.01 and a standard deviation of 0.87. It implies that the participants, composed of nursing students, don't endorse the usage of e-cigarettes. Now for the difference in the level of knowledge. There were no significant differences observed in the level of knowledge when grouped according to year level, smoking status, and family monthly income. However, a significant difference was observed when grouped according to sex. The result shows that females demonstrated a higher level of knowledge compared to males. This suggests a presence of gender disparities in understanding e-cigarettes. Now for the differences in the level of attitude. There are no significant differences in attitude when grouped according to sex, year level, and family monthly income. However, there is a significant difference observed regarding the smoking status. The result shows that the current and former smokers tended to view e-cigarettes more positively compared to non-smokers. This implies that those who use e-cigarettes generally have a more favorable view of these devices, which stems from their own experiences using them and the perceived advantages they offer. On the other hand, individuals who don't use e-cigarettes are more cautious about them as they are concerned about their potential health risk and the wider impact on public health. And lastly, the relationship between the level of knowledge and attitude. The result shows that there is no significant relationship between the level of knowledge and attitude. It indicates the level of knowledge about e-cigarettes is not statistically related to the level of attitude of the participants.
The study explored the demographic profiles, levels of knowledge, and attitude of nursing students toward e-cigarettes. Key findings for demographics are predominantly female participants reflecting nursing's gender disparity, majority from middle to upper middle income families indicating a comfortable financial support level, more participants in their fourth year than in their third, and most students had never smoked or used e-cigarettes. For the knowledge, nursing students displayed a good understanding of e-cigarettes, suggesting that their educational program effectively covers emerging health trends. And female students showed higher levels of knowledge compared to males. For the attitudes, their attitudes were generally good but varied, indicating a diverse personal perspective within the group. No significant differences in attitude based on social-demographic variables except for smoking status. And e-cigarette users showed more favorable attitudes, highlighting the impact of personal experience on perceptions. For the relationship between knowledge and attitudes, the study revealed no significant correlation between the level of knowledge and attitude toward e-cigarettes, underscoring that knowledge does not necessarily influence attitude. The study highlights the importance of comprehensive education and nursing programs on tobacco control and the nuanced approach needed in shaping nursing students' attitudes toward emerging health issues like e-cigarettes. For the recommendations, we recommend the university administrators to integrate comprehensive education on emerging health issues like e-cigarettes into the nursing curriculum, to develop targeted educational initiatives to bridge knowledge gaps and engage all genders effectively, and to stay updated on the latest research to impart current knowledge to students. For the College of Nursing administrators, to allocate resources for workshops and training sessions on the dangers of e-cigarettes, and to employ diverse educational tools to ensure equal understanding among students. For the healthcare professionals to tailor interventions and communication strategies to address gender and personal factors influencing attitude toward e-cigarettes, and to advocate for targeted interventions promoting evidence-based attitudes among nursing students and the broader population. For the student nurses to actively seek information on risks and implications of e-cigarettes, initiate peer education programs to spread awareness, and to utilize gained knowledge to advocate against smoking and e-cigarette use. And finally, for the future researchers, to increase sample sizes and extend study scope, to include different year levels in colleges, conduct longitudinal studies to assess changes in attitudes and knowledge over time concerning e-cigarettes.